Good afternoon. My name is Dr. Chris Bird. I'm here on behalf of the Coastal Bend COVID-19 Pandemic Task Force to bring you this week's updated COVID report and forecast. It's February 19th, 2021, and I, for one, am very happy that this week is about to be over, as I think a lot of the rest of you are too. So just to remind you, the task force has two primary objectives. The one is to address your concerns and questions about COVID-19 and the interventions taking place to combat the pandemic, and two, to help enable evidence-based decision-making on behalf of our local leaders. So there are several interventions that are taking place right now to control the transmission of COVID-19. The first of which is, if you're eligible, you're encouraged strongly to get vaccinated. 2, stay at home if you can. 3, wear a face covering. Better yet, if you're wearing one of those cotton face coverings or a surgical mask, double up with a cotton and a surgical, or 2 cottons or 2 surgicals are better than just one. As well as maintain social distancing when possible. Isolate when exposed to somebody who has tested positive or when you're symptomatic yourself. And there's partial to all remote schooling occurring. And lastly, businesses are generally operating at 75% capacity, and bars are open at 50% capacity. This would be if we weren't in the middle of this kind of deep freeze emergency weather situation that we're in, where there's a lot of businesses that are closed right now. Okay, we're up to 40,322 total confirmed cases of COVID in the Coastal Bend. A confirmed case could be a case that is detected with the gold standard PCR test, or it could be one of the other tests combined with a clinical diagnosis would lead to a confirmed case. And there's been 37,391 recoveries, leaving us with 1,846 active cases. If you're wondering why active cases plus recoveries doesn't add up to total cases, that's because fatalities need to be included in that equation also, and we'll talk about that later. But the active cases is what you should focus on here, and you can see they're trending downwards. This week they're down 29% over last week's report. The transmission rate estimation is going to stay the same for this week. This is a graph of the transmission rate through time from the summer outbreak in June through to the present time. Right now we have 2 projections. The lower projection is 0.8. The upper projection is 0.9. This means that for every 10 people that contract COVID, on average, 8 to 9 of them pass it on to one additional person. In this scenario, marked by being below this dashed line here, indicates that COVID is decreasing and we're seeing fewer cases moving forward. So if we can keep the transmission rate below 1, COVID will continue to decline. And thus, on this graph, we're showing the number of new cases per day. The black dots represent the actual numbers that are reported by the county and the state for the new cases per day. You can see recently they're getting pretty low, and we have our 2 projection lines put through there showing you our upper and lower projection. Now, we're not sure if some of these very recent case counts are low due to the weather. Let me rephrase that. We're pretty certain that some of the low case count numbers presently are due to this week's freeze and cold weather conditions, and maybe there's been disruptions to people seeking testing, disruptions to the reporting of testing results. So that is happening, but also realize that we were already projected to be in a decline. This is the same projection as last week, and so there's the effect hasn't been that big that we needed to change our projections. So right now we're projecting a continued decrease in the number of new cases if things continue as they had been last week. Looking at the number of new cases per day in each of the Coastal Bend counties, we can see that there's been a very steep decline in the number of new cases per day in Nueces County and less of a steep decline in most of the other counties. So let's zoom in on those counties because Nueces goes so high it makes it difficult to see some of these other counties, and you can see that we have B, San Patricio, Jim Wells, Aransas, Clayburgh, Refugio, Duval, and this is McMullen in the purple, although it's not labeled. But in general, when you look at these, the major trend that you see is a decrease in the number of new cases per day across the coastal bend. Zooming out to the metro areas in South Texas, we see a similar decline in new cases per day per capita, or per 100,000 people across South Texas. So this is trending in the right direction. It's not just us in the coastal bend, it's the whole South Texas area. And if we zoom out even further to the whole state of Texas, breaking it into its public health divisions, then we can see also all of the public health regions are declining in terms of new COVID cases per 100,000 people per day. And they're all in a pretty similar range here, below 30 new cases per 100,000 people. Moving on to hospitalizations. And again, here with the black dots, you see the actual number of people in the hospital with COVID each day. It's the census, so the same person may be counted several days in a row if they're in the hospital for those days. So this is not the total number of people hospitalized over the whole pandemic. It's the number of people hospitalized on a particular day. You can see that we have continued decline, and it's kind of following the upper projection line as opposed to that lower projection line. The new cases per day were more following the lower projection line, so that's why there's some uncertainty here between which projection line is more accurate. So we show both of them, and as the data comes in, we can decide whether one or the other is more correct or if it's somewhere in the middle. Something that we've been tracking very closely with hospitalizations is the proportion of staffed beds that have COVID patients in them. We're at 10% right now, or as of the last time this data was updated. The reason why this number is so important, because if it goes above 15% for 7 days in a row, then that triggers a rollback of business occupancy to 50% from 75%, and it would also trigger the closing of bars. But we don't foresee that occurring right now in the immediate term or the near future. Okay, focusing in on the ICUs in the hospitals. Over the past week, the number of patients in the ICU has remained fairly level, but if you step back a little bit, you'll notice that we have a developing pattern of decline, and this is a trend that we've been seeing leading up to this point. You're going to see that continue throughout the presentation. So the red portions of the bars here represent the numbers of patients that have COVID in the ICU, 46. The number of patients that are non-COVID, that's 137, and the total number of patients, which is 183. Overall, the number of COVID patients in the ICU is declining, while the number of non-COVID patients is remaining relatively steady. As you can see, the decline here in overall patients is approximately the same as the decline here in COVID patients. This graph is just like the last graph, and actually that last graph is right here, but it's applied to the whole state. So every trauma service area in the state here is represented. If you want to focus in on a particular area of interest, you can pause the video to inspect more closely. But overall, every single trauma service area is experiencing a pattern of decline in COVID patients in the ICU. This is like the previous graph, except it's only focused on one day, and we set it so that this shows you more of a proportion of the patients that are COVID positive in the ICU. I think that this is a good indication of the amount of pressure or strain on an ICU, and the more red you see, the more strain there is. So here in the Lufkin area, El Paso, Victoria, Laredo, and the lower Rio Grande Valley, you can see that there's fairly high pressures on their ICU from COVID versus here in the Coastal Bend or in Lubbock and some of the other areas in Texas. So these numbers have been declining across the state, and hopefully that will continue. Moving on to fatalities, I think that the inclement weather that we've been having is probably affecting the counting of death certificates. That's where these data points come from. The black data points are the number of people that died due to COVID on a particular date, and they're tallied based upon death certificates that are sent to the state. And we saw this over the holidays, and I think we're seeing it again right now where there's a backlog of processing those death certificates. So that's why you see these really low numbers here, where normally the numbers would be higher and up around where the projection is. So we expect that these will unfortunately increase to come somewhere around the projection. You can see that it can shoot above or below, but overall, moving forward, we expect that the number of fatalities will decline. And remember, fatalities trail hospitalizations and hospitalizations trail cases. So the cases have been going down for a while now. Because of that, we know that the fatalities are going to be declining for several weeks. Even if cases start to go up tomorrow, the fatalities will continue to decline. So hopefully we can keep that trend going for cases, hospitalizations, and fatalities. We want them to decline until there's no more. The total number of fatalities in the Coastal Bend right now, the official count at the state is 1,085 due to COVID. And in Nueces County, it's 681. Now, this data is coming from the state, and the county releases data a little bit more quickly than the state does. So this number is probably slightly behind the latest number that you've heard for Nueces County and what will be reported later on today by the county. Okay, moving into a more cheery note, the number of people that are getting vaccinated. So the more people that get vaccinated, the less transmission there is. And the way to look at this would be, say, like here in Nueces County, and realize these colors match previous graphs where the counties are broken out if you want to see them side by side. But right now, about 5% of Nueces County, according to the state's tallies, have people that have been fully vaccinated. 5% of people in Nueces County have been fully vaccinated. And so what that means is we can take a 5% discount off of the transmission rate just due to vaccinations. Now, a portion of those people that are getting vaccinated already had COVID before, and maybe they already had some immunity, so we need to take a percentage off of that. So maybe now we're looking at maybe a 3% discount. And there are people that will get COVID even if they have been fully vaccinated. That's still a thing. Now, one thing I want to remind everybody is that while you still may contract COVID even after getting vaccinated, I don't know of any circumstances where somebody got their full vaccination course and contracted COVID after their full vaccination course and died. So it seems that the vaccinations are having a big effect on the rate of fatalities as we would have expected. And so that is a good sign. But I want everybody to realize that on the axis here, we're only going up to 8 percentage points. And we could go all the way up to 80, 90, 100%. Now, we know not everybody's going to get vaccinated overall, but I just want to let you know that we're really zoomed in here because we're still in the early stages of vaccinations, and you shouldn't get the impression that we're almost there. We have a long ways to go. Looking at the whole state and the proportion of people fully vaccinated across the whole state, broken down by trauma service area, you can see right here we have the Coastal Bend, which is trauma service area U. So again, that's at about 5% of the population, just like Nueces. And if you compare us to the other trauma service areas, we're somewhere in the middle. Now, I've been told that more vaccines can be directed to counties and trauma service areas where COVID was more prevalent. So the Panhandle is a location where they've had some pretty big outbreaks. and that's one of the reasons why you're going to see a higher vaccination rate there than locally. But other than that, population size is determining the approximate amount of vaccines that are distributed. You can see that there is not too wide of a range here. I want to point out again that the maximum here is 8% of the population being fully vaccinated. That means both dosage 1 and 2 of either the Pfizer, BioNTech, or Moderna vaccines. And we've got a long ways to go before we can achieve herd immunity due to vaccinations rather than people contracting COVID and recovering. So in summary, the transmission rate is below 1, which means this fall-winter outbreak that we've been in for so long is subsiding finally, and we're really hoping that this continues. All 3 cases, hospitalizations, and fatalities are declining, and we expect that this decline will continue. Realize that some of the recent numbers that you're seeing this week may be affected by the inclement weather that we're seeing. Now, if somebody's getting tested, say this week, we might not see those numbers for a little while, but people might be avoiding getting tested. It might be there might be hangups in the pipeline of getting data to the state right now. So this is causing at least slightly fewer cases than we would have expected, but it's not really outside the range of the 2 projections. You're encouraged to stay vigilant here. I know that this has been a long time, but these are really, it's really simple, the things you can do to help end this pandemic. Number 1, get vaccinated if you can. 2, wear face coverings, double up if you can. Social distance, wash your hands, avoid multi-household celebrations. Now, right now, I want to put a caveat on this. If you're in a situation where your health or the health of other people in your families is potentially compromised because you don't have power, you don't have water or something like that, then of course you should seek out shelter in some other place with friends or family. It's more, that's going to be a more pressing issue than avoiding COVID. At the same time, even if you're doing that, which I know that at least some proportion of the coastal bend is, try to maintain those barriers between people from different households as best you can. Be courteous. Different people have different views on masks, and you may not know about the predispositions that your friends or family may have to COVID that they haven't shared with you. So be respectful, wear masks when appropriate, and try to social distance, and everybody try to stay safe out there and warm. That's the report for this week. If you have any questions or comments, you can post them on our social media accounts. We have Facebook, Twitter, Instagram. Our handle is @CBCovid. You can access these most likely without even having an account, just to read the posts that we have there. We address the questions each week on Friday at 12 noon in a question and answer session. And also, if we have any updates or major changes in COVID between now and the next report next Friday, we'll sometimes post an update to social media with a particular figure or graph updating you. I know that I think we're going to post some summaries of these most recent trials of the vaccines against some of the different variants that are out there to try to boil it down to brass tacks for everybody. So thank you very much. Stay warm, stay safe, and we'll see you next week.